Why does transverse myelitis cause chronic pain? Imagine your nerves as a busy highway, 4 signals traveling between your body and brain. When transverse myelitis occurs, it's like a section of that highway gets damaged by inflammation, disrupting the normal flow of signals. This damage mainly targets the spinal cord, which is a crucial pathway for sensory information like touch, temperature, and pain. When the spinal cord is inflamed, the protective covering around the nerve fibers called the myelin sheath gets damaged, a process known as demyelination. Without this sheath, nerve signals become distorted or slowed down, causing the brain to receive faulty information. This miscommunication often results in what we call neuropathic pain, which feels like burning, stabbing, or squeezing sensations that can happen in the limbs or around the trunk. The inflammation damages not only the nerve fibers but also the nerve roots outside the spinal cord, which can add to the pain. Sometimes, after the initial injury, nerves try to repair themselves by regrowing, but this process can go awry, leading to abnormal connections that generate pain signals. Additionally, the brain normally sends inhibitory signals to suppress pain, but transverse myelitis can interfere with these pathways, removing the natural brakes on pain and making sensations feel more intense or persistent. Because of the nerve injury and the body's response, patients often experience secondary musculoskeletal pain. When movement becomes difficult or painful, people might change how they move or hold their bodies, which can strain muscles, ligaments, and joints, adding another layer of pain. This combination of nerve damage and musculoskeletal issues makes chronic pain in transverse myelitis complex and often resistant to simple treatments. Managing this pain usually involves medications aimed at nerve pain, physical therapy to improve movement and reduce strain, and sometimes more advanced procedures like spinal cord stimulation if other options don't work. From the perspective of multiple sclerosis, which also involves immune attacks on the central nervous system, including the spinal cord, the pain mechanisms are quite similar. Both conditions involve inflammation that damages myelin and nerves, disrupting normal sensory signals and leading to neuropathic pain. Recognizing these shared pathways helps us understand why managing pain in these conditions can be challenging, but also highlights the importance of a comprehensive, personalized approach. In summary, chronic pain in transverse myelitis happens because inflammation damages the nerves in the spinal cord that carry sensory information. This damage causes abnormal nerve signals and disrupts the brain's ability to regulate pain, leading to persistent, often disabling pain. It's a complex process that requires careful, multidisciplinary management to improve quality of life. Always consult healthcare professionals for personalized treatment options, as individual experiences with pain can vary widely.